My name is Samantha Lodish, and the disease I investigated was lung cancer. Lung cancer is the abnormal growth of cells in one or both of the lungs. These abnormal cells cluster together, forming a tumor. The tumor destroys any healthy tissue around it, making it a malignant tumor. As the tumor grows, it prevents the rest of the body from functioning properly. Lung cancer is classified into two basic groups: non-small cell, which makes up for 80% of lung cancers, and small cell, which accounts for the other 20%. This classification is determined by looking at the lung tissue under a microscope. Lung cancer is the leading cause of death among both men and women. It kills more people than colon, breast, and prostate cancer combined. An estimated 155,000 Americans are expected to die from lung cancer in 2016. The age-adjusted death rate is higher for men than it is for women, but it is similar when comparing African Americans to Caucasians. During 2016, an estimated 224,390 new cases were expected to be diagnosed. The majority of those living with lung cancer have been diagnosed in the past 5 years. The lung cancer 5-year survival rate is about 18%, with more than half of the people diagnosed dying within 1 year. In North Carolina, lung cancer is the leading cause of cancer deaths, but has been on the decline since the change in smoking patterns over the past few decades. The lung cancer process is started either by the activation of oncogenes or the inactivation of tumor suppressing genes. There are several risk factors that can cause this genetic mutation. The leading cause of lung cancer is tobacco smoking. It accounts for approximately 80% of cases. While smoking is the most frequent cause, it isn't the only one. Non-smokers are at risk from things such as workplace exposures, including asbestos, diesel exhaust, or radon. Inherited or acquired genes changes also cause an increased risk of lung cancer development. There are several different tests that a physician can perform in order to diagnose or rule out lung cancer. Imaging tests are usually one of the first methods used. An X-ray can show any potential abnormal masses, while a CT can show smaller areas that may not be seen on the X-ray. If a cough is present, a sputum cytology may be performed. This is when the sputum is examined under a microscope to see if any lung cancer cells are present. A tissue biopsy is performed when the provider takes a small sample of the abnormal cells from the lung tissue to be examined. Once a tissue diagnosis is confirmed, a process referred to as staging occurs. This is when they look to see if the cancer has spread to other parts and identify if surgery is a treatment option to remove the cancerous areas. Treatment will depend on quite a few factors, including the type and stage of cancer, overall health otherwise, and personal preference of the patient. Options for treatment include surgery, radiation therapy, chemotherapy, targeted drug therapy, and/or any combination of those mentioned above. Specific surgery that may be conducted include lobectomy, pneumectomy, segmental resection, and wedge resection. Each of these options takes a different amount of the lung. In addition, there are clinical trials available for new and emerging techniques, as well as palliative care to help aid in handling the side effects of treatment. While there is no surefire way to avoid getting lung cancer, there are some things that can be done to lower risk. Avoiding tobacco is the biggest one, as it accounts for over 1.5 million cancer-related deaths. Other prevention methods include testing your home for radon, avoiding workplace exposures, a healthy diet, and exercise. Lung cancer screening tests are now being recommended if someone currently smokes or did smoke for a long period of time, and they're between the ages of 55 and 74. This screening includes a low-dose CT scan, which has the potential to catch any abnormality that may have otherwise gone unnoticed until symptomatic. In 2007, 50.6 lung cancer deaths occurred per 100,000 people. The Healthy People 2020 goal is to lower this number from 50.6 to 45.5. By 2014, the rate has already dropped to 42.1, which shows that the desired decrease is being met. Please see attached references, and thank you for taking the time to listen.